Hi, this is Dr. Saxena, and I've been talking on some various topics during this last 3 months. And one of the topic which I absolutely missed on, and that is basically what is happening because of these frequent lockdowns, what is happening to the social health, how the people are coping up with this kind of stress. I somehow have to admit that as doctors we had a tough time during all this pandemic, and it's not that easy trying to cope up with your work and trying to stay with your family and all that. So I just thought, let me put this segment, what I'm thinking of, because this particular thing which is called depression. I'm talking about, there are things on rise. What are the warning signs of people having this suicidal tendencies and all that? Let's discuss that particular stuff. And what are the commonest mental disorder these days is nothing but depression, and how you can always, by changing your diet, by changing your kind of electromagnetic radiation, by changing your diurnal rhythm, trying to look into what is not you're not getting in sync with, can help you. So this particular thing which I always had a thing was, I felt this depression is because of major nutritional deficiencies, and yes, there is a slight decline in social interaction brought about by increasing reliance on the social media and technology. Excessive exposure to electromagnetic fields is a major cause. More of screen time with the TV and your of course with your cell phone. Lack of sleep, and I have seen in my patients who has this chronic disease, particularly battling with stage 4 cancers and other problems. They have this lack of life purpose, or they are not getting that spiritual connectivity. They're not getting into that spiritual connection, and I see people having particularly cancer patients and patients having some autoimmune problems, a lot of chronic unresolved stress. These are all contributes to the depression, and this is a thing which, as a clinician, I was not really looking into that particular stuff, because I used to see that okay, his pain is gone, his kind of endurance has increased. A cardiac patient who is not able to come up more to 3 steps, now he is able to walk up the fly one stair of thing. I was not really looking into that. I was always trying to see that usually in our practice, we family members do come along with the patients, and we see the family. Once we see one family member along with the patient, and we were quite I used to take it for granted that he has a family backup in a good way, and the people who never used to come with only the patient used to come alone, we used to really work for him and see that last mile connectivity, how he is going back to his home and all. Well, my staff, who is a supporting staff, they take care of all that stuff. So this particular depression is a can be a terminal it can be a terminal illness if a person continuously attempts or eventually successful taking his own life. I had seen people with depression, suicide rates are quite high, and one of the thing I have been last week, one of my patients' son told me, is this guy is not getting proper, he has got some neurodegenerative problem, and his son was telling that he is absolutely vexed with his life, and he's contemplating of doing something to his life. So this particular thing is, I can accept that, okay, for a person who has lived his life and he's battling his stage of cancer or neurodegeneration, having this paralysis and all, and that sort of thing, if it is happens to that age group, it's fine. But what we are seeing is children's suicide is also rising sharply among children and teens, and it has to be, they simply must speak to some deeper societal problems at work, and I'm very sure many antidepressants are not the answer, and because I can always tell you, many antidepressants are known to increase the risk of suicide in children and young adults. I had seen this particular phenomena when I was working with autism, and we had seen these things doesn't work in fact, when we were working on autism, we had to really, it was not just the patient autism, even the parents also, they were requiring some kind of things to help their anxiety, to help their depression and all. So it's a big problem. I'd like you to understand what are the warning signs of suicide and how you can help the person. There are some people are better at keeping their depression in thoughts of suicide well hidden, even from ones they love. It is important for everyone to recognize the warning signs, which are, they start telling the signs that someone may be contemplating or getting close to suicide are, they feel they get isolated. Number one, they have increased anxiety. They feel like a burden in the family. They are not productive. They feel that I'm not doing anything and I'm a burden to the family. Feeling trapped or unbearable pain. People having that particular stuff. People looking at weight, increased rage or anger. You have something like excessive mood swings. You have got expressing hopelessness. They are always always negative. They start talking everything in a negative way, and they are sleeping either too little or too much, or they are talking or posting about wanting to die, and they are making plans to suicide. These are few of the signs you should always look. If you notice any one or more of these signs, take the following simple steps which can help you to avoid any particular problem. You need to ask them how they are feeling, and if they are considering ending their life, if they have planned to do so, you need to ask them. Don't let them be alone, and do your best to keep them safe, and make yourself available to them. And yes, we always tell them, I'm just a phone call away. Reach out to them daily and help them connect to others, and do a constant follow-up. And always there are some centers like Roshni, Harvard, so these are all the things which can be worked out with these people. So coming to this depression, I don't think depression is overlooked. We believe that it's the most important thing here, which this neuropsychiatric disorder is the EMF exposure. This is in 2016, Martin Paul, he wrote magnificent and comprehensive review on this. It's available free online, and he reviews how regular exposure to low intensity microwaves like those from your cell phone and Wi-Fi impact your nervous system. These are the two important things which I believe is causing a big issue. And there is kind of work which was done by others, and this is it has to be worked on in a different way, and we do believe that these are some of the contributing factors of the suicide and all that. It can be because of your relationships, it's because of your substance abuse, and they are in the present, they are in the crisis. In the past, they have financial problems, or there are some different areas, and I certainly believe this antidepressants are not a satisfactory answer. Antidepressants, yes, it has been prescribed for all these things. It can harm your immune system, you raise your risk of type 2 diabetes, and all the side effects have you can name a lot of things which. So we would like to see there are some safer and better alternatives, what we can work it out. The best thing which I try to work it out is nutritional intervention. Nutritional intervention is these are key dietary considerations and helpful nutrition supplements. See, this people eat a whole healthy whole food diet and avoid processed foods and junk food, right? One of the first steps in addressing problems like anxiety and depression is to clean up your diet and address your health. See, this diet takes a most important thing. Foods have an immense impact on mood and ability to cope and be healthy. And you need to have a nutrition plan. Simply avoiding grains as well as sugar, it takes a big step. It's the first important step is try to avoid this white sugar and try to avoid these grains. Try to reduce your refined sugars as much. This will normalize your insulin and leptin levels, and this is a powerful tool in addressing depression. Go for gluten-free diet, which is we always tell. Gluten is related. Gluten in the wheat is gluten is found in not just wheat; it's found in other things as so. But this is one of the things. Gluten produces depression if you are sensitive to it. Optimize your omega-3 levels. Omega-3 levels are good fats. These good fats have to be optimized in a proper way. And we had discussed everything about that. Omega-3 correction is a big thing. We talk about something like flaxseed, we talk about something like ghee, we talk about something like sea cod liver oil. These are all omega-3, whereas omega-6 is one thing which has to be reduced. All these refined oils, vegetable oils have got omega-6. The other thing you can do is optimize your vitamin D levels. Optimizing your vitamin D levels also makes a big difference, and I have been always on this particular stuff. Your unbalanced gut flora has been identified with a significant number of factor to depression, and you should have to work on that, trying to take some good probiotics, try to take something like fermented foods and all this. This will help you in a big way, and include a lot of vitamins, B vitamins, B1, B2, B6, B9, B12, all these things. There is we have reasons to believe that even something like vitamin B6 deficiency, vitamin B6 is very important for mood regulation and brain function. There is a thing called folic acid deficiency, which is known to produce the depression. So you need to be on this side, trying to take a lot of good vitamins and all, and without this it is slightly difficult. And other things which I try to work it out is if the person is having some perimenopausal problems or postmenopausal problems, you have somebody with andropause, and what is happening to his hormone levels. We need to look at that, and we try to work with him. So the things is as simple as trying to follow the diet, trying to give some lot of vitamins, trying to work with some omega-3, increase the omega-3, increase the vitamin D, exercise regularly. You need to have that exercise, including the strength training. This is one thing which you can, if you can do, I'm sure your depression will vanish within 6 to 12 weeks. You need to make a 30 minutes aerobic exercise, or you have to work out at least 4 or 5 times a week, and it's a amazing thing. Exercise improves your all the hormones. It improves your kind of all this physiology in a big way. All the neurochemicals are properly monitored with this product, and unnecessarily don't get into unresolved emotional conflicts if you have anything, and try to avoid stress at any point of time. In fact, I try to work on something called light therapy. I try to work on something like I try to give you measures how to reduce your EMF exposure, and we try to work on something like hyperbaric oxygen for this depression. It's amazing, and we have something like hyperthermia for this depression. And apart from your yoga, your acupuncture, your massage and all that, if you're not getting any response, you can always try this our biofeedbacks and hyperbaric oxygen or hypothermia. I'm sure this will help you in a big way. But the key here is to do everything simultaneously and go one step, try to do one at a step, and yes, it has to be a 360 degrees approach, and antidepressants are not just the answer, though we ask you to just continue with your antidepressants, but it is somewhere unnecessary things should be kept out. A lot of emphasis should be given on your nutrition, your electromagnetic radiation and all this stuff. So this is one thing which has to be worked out. I've been talking to so many people during these lockdowns and trying to emphasize them that they should not cut down their Wi-Fi, and they start using that optical fiber. You have a LAN card, you have Ethernet cable. Use that particular stuff. That makes it things. Thank you.